everybody, and thank you for your patience with us. And I'm really, really excited for today's program. Not only do we have this fantastic branding on this platform, which I'm really grateful for, but I cannot wait to hear the panelists of today's program talk today. So today's program is Your Employee Has COVID, Now What? I don't know the answers, but I'm looking forward to getting some of them. I know a lot of people that have asked us here at the chamber, we have to close for 14 days. Does someone need to negative test? What are the right answers? And I feel like there's a lot of misinformation out there. So we wanted to bring together the experts and be your resource and really talk about, get you some of those answers to those questions. So today you're going to hear 3 presentations from our 3 panelists. We have Michael DeSmedt from the DuPage County Health Department, Rebecca Boyd Obarsky from Nagel, Obarsky and Holzhauer, and Kevin Courtois from the UNES Chamber here to talk to us today. Like I said, we're going to give us about a 10-minute or so presentation to begin with. We're going to go through each of those in that order and then open it up for Q&A. And I feel like that's where a lot of this really good meat is going to come in to get some of the answers to your questions about what we need to be doing as employers to keep our employees safe, but also keep our customers safe as well. So I'm going to start it off by sending it over to Mike DeSmedt. Mike is the Assistant Director of Environmental Health for the DuPage County Health Department. He leads professional staff conducting food, pool, daycare, and other various inspectional activities to make sure that the public is healthy and safe. But currently, Mike has been in charge of the DuPage County Health Department's business resource team. Now, that helps the county businesses by educating and assisting them to operate safely during COVID-19 and within the state guidelines. In addition to running the business resource team, Mike has been spending a few days a month as the incident commander at the community-based testing center. So it sounds like you've had a very interesting past few months, Mike. And I'm going to toss it over to you for your presentation to start us off.
Great. Well, thank you so much. I appreciate this chance to talk to everybody. And definitely appreciate this chance to show what we've been doing as a health department. So since March 17th, I've not been doing my job as assistant director. And as already been said, I've been leading our business COVID team to try to help starting off more or less small business at the beginning. As we opened it up, it was more very large factories, to now dealing with more small businesses that have been open in phase 4 and helping everybody in phase 3. So really it's been trying to navigate everybody is how we can operate safely and effectively and where to find resources, because it's really difficult right now to find some resources and what's going on. So I'm going to start with giving just a quick overview of what's going on in the state and then locally, and then I'll go into some more details. So we can go to the next slide. So as of Monday in Illinois, we had about 251,000 cases of COVID in Illinois, over 8,000 deaths, 4.5 million tests. Recovery rate is 9.6. We're still obviously waiting to get people in hospitals and other stuff in there. So just want to lay out some sobering numbers for everybody just to see what's going on in Illinois. Next slide, please. So this graph leads all the actual COVID cases in Illinois. If you ever look at it or see it, there's one weird anomaly. It's the one about the 5th or the 4th of September. There's that huge spike. That spike's not real. There was a lag in testing. So I think the testing center gave 5 days result into 1 day. So that's why that is so high. So if you see anything like that, that actually is not accurate. If we go to the next slide. So next slide shows deaths. So the positive things, as we can see, the deaths are coming down in Illinois. So that's a huge positive from there. So that was an overall. So I know part of Naperville is in Will County and part of it is in DuPage. So unfortunately how the state broke us apart, Will County is with Kankakee County. And as we all know, they have their own problems. They have a much higher rate and they're going through different stuff. So I don't know a lot about that. My job is protecting us so we don't go to that level and trying to really educate everybody so we don't go to that level. So if we can go to the next slide. The next slide shows with Region 8 is DuPage with Kane County. We are together. So when you put us together, there's a number of cases and deaths we have, which is nothing any of us want to see, and definitely a number we can all get better. But what has happened is the state of Illinois has chosen to put us together, and by doing that, we have certain rates and certain things. If you go to the next page, what could cause us to be more restrictive, like what happened in Will County. So we started with the 7-day rolling average of positivity rate. As of Monday, it was 4 days. Yesterday, today is a really positive day because now we're down to 3, so it's really good numbers. Our numbers are starting to stay steady, starting to go down again. After that, we had the spike, so hopefully they will continue going down. And so there's other things, hospital admissions and consecutive dates going over that. So that's really the dates when the bad stuff happens. And that's stuff we're trying to not go back. So let's go to the next slide. So what has the health department been doing? I'll go in a little bit of that and also go into a little bit of what I've been doing. So people know stuff I've not been involved with it is we are producing PPE. So we've been giving hospitals, healthcare centers, and daycare centers and other places PPE that comes in from the national stockpile. So we've been having that. We have that on sale to help people get PPE and other protective equipment is one of the things we've been doing. From the business standpoint, we'll go to the next slide. Since that March 17th day I talked about, my team, we've helped over 650 businesses, provided education with them, resources, and other stuff. On average, you can see here, we're talking 30 to 60 minutes we spend with the business. And on an average day, we're getting 10 to 15 inquiries. And like I started off, back in the early times, we were dealing with large manufacturing because those businesses were open. And now we're dealing with more outdoor stuff. We're doing parks, daycares, pools, camps, and how to actually work within the guidelines. I think one of the biggest things that we all know is, unfortunately, when DECDO put out their guidelines, they put it out for all these specific businesses. Well, a lot of these businesses have multiple of these types of resources inside their buildings. So we have to figure out what works for them. How does this work? So we spend a lot of time trying to guide people through to what that does. Probably the biggest thing that I'm really proud of is we've been helping small businesses, their HR department, if they even have an HR department. Some places have one person that's a jack of trades and they get everything. It's really helping them when they get a positive case to get through it and to calm their fears and to help them really through it, where large businesses have these resources where small businesses don't. So it's something we've really been able to be really proud of, providing educational stuff, resources, our toolkit, answering questions, going on Zoom meetings with them, having meetings, and to really help them, provide them how they can really get through this time and to show, yeah, you can operate safely. And I think just talking to everybody is you can get it anywhere. It's nothing to worry about. It's more of just really trying to make sure that you educate all of your staff to make sure they understand what's going on. Because that's one of the biggest problems we find out is not letting your employees know. So you always want to let your employees know. And we have all these things available for you to go do that. So we go to the next slide. We'll talk about one of the other things we do. Yeah. So this is our actual testing center. So the testing center we have is located at DuPage County Fairgrounds. It's now open from 7 to noon, Monday through Friday. You don't need insurance. There's no payment. It's the PCR test, which is the more accurate test. It takes about a maximum 4 days to get the results back. We're seeing more of them in 2 days, but they'll tell you 4 days. And it's really going well. We do about 600 tests a day until we close down. Mm-hmm. So it works really well. And it's really been helping out people doing stuff like that. We also have, besides my business resource team, I have an educational resource team here at the health department, and they're working with the schools on reopening and how they should do stuff and daycares. And not to mention, we have our upper management spending a lot of time with mayors and managers of how to deal with how all this going on. But let's go back to what you guys need to know from me. So we're going to slide. All right, so the next slide shows there's a phone number on there, and that's probably one of the biggest, most important phone numbers we have. So if you have a case or you have a positive, to report that positive to the health department, here's the phone number. There is a statewide system. Some of the positives we have, some of them we don't. So any we can get, that's great. And that will allow us to do our tracebacks. Most of my staff are conducting and helping do these tracebacks. So we are talking to all the sick. We're talking to all the sick like that. And then we're also doing tracebacks to everybody that came in close contact to make sure they're quarantining and doing what you're supposed to. So I think one of the biggest other questions that we get is the difference between quarantining and isolation. So everybody knows isolation is ill. That means you are ill or you've been tested positive or you have symptoms. Quarantining is for close contacts, just to stay away from everybody to see if you actually do end up being COVID positive. So we'll go to the next slide, and it shows a lot of our what we work from. So the part on the case side on the left will talk about cases, and that's ill, and describes, hey, if someone is ill, if they've had specimen collected or from their symptoms, it's a minimum 10 days that they're going to stay home from work. Then after those 10 days, they need to be fever-free and feeling no other symptoms for 24 hours. So it could be longer than the 11 days there or less. There was some testing-based things that say if you have 2 negative tests 24 hours apart, you can go back. That's really not recommended for medical community. However, if you have your own infectious control disease and your physicians on staff or who you consult with, if they still want to use that, you can go ahead. But as a health department and as a state agency, we're sort of going away from that. But what the biggest one is the next part, and that talks about close contacts. What close contacts are is if you've been within anybody who's ill 6 feet for more than 15 minutes, that's when the quarantine kicks in. And that's the biggest thing that we have to talk about and look at our businesses is try to keep our staff as far away from each other as possible to be able to do our jobs. If someone comes in, someone is ill, then if we have to quarantine half our facility, can we operate? So we have to make sure that we're always trying to think about how can we still do our jobs, do what we're doing, but keep everybody 6 feet apart for more than 15 minutes so that we don't go into these close contacts. And that's one of the most challenging things. There's masking, no mask, there's nothing. You have to be 6 feet for 15 minutes. Masking doesn't matter, and people ask us that question too, and other stuff like that. So we go to the next slide. So this is the biggest thing. If you go into the link here, which they'll provide you after after the presentation, the link itself will give you all of our resources we have for businesses. So it lists all of our resources. We also go to the CDC's resources, the State Health Department resources, and there's also the business email in there, which is covidbusiness@dupagehealth.org. And you can ask any question you have, and we can help you with that. But if you have any cases, if you go back to the first phone number I gave you, they can help you with that. And then once you get a case, our CD Epi team will work with you on those cases. And then eventually they'll convert you back over to us. And we can go help you guys with any resource you may need, anything you need to put out to your staff, or any sort of resources you need as cleaning supplies or anything. Who should actually quarantine and how that all works. We're there to help, and we're here to do that, so we can do that. And then the final resource that I have available for you is DECIO. And DECIO is who's allowing businesses to open with the state and the guidelines. So if you go into there, it's going to list the phase 4 guidelines. And are you a retail? Are you a business where there's nobody else coming in there? All the different requirements are all in there, and we can be there to help you navigate that or understand what does this mean for us. And again, the thing is that we've got a lot of places, like I said before, that are affected by multiple levels of these different types. So we're there to help you try to navigate how that all goes. I appreciate your time, and if anybody has questions, I'm going to be around to answer them, and we can go from there. Thank you so much.
Awesome. Oops, hang on. I think I have to unmute it. So thank you, Mike. I really appreciate it. And you're going to stick around for questions. So those of you who have questions for Mike or any of our presenters, there is a chat function on the side. So chat them in, please, so that we can see your questions and we can ask them. So I'm really excited for this Q&A. But first, we're going to listen to our next panelist, who's Rebecca Boyd Obarsky. Rebecca's firm, Nagel, Obarsky & Holzhauer, represents many local small businesses. In addition to general corporate matters, Rebecca assists clients with workplace and employment issues. She's counseled several clients as they've navigated the stay-at-home orders commencing in March. the federal paid sick leave and CARES Act legislation, and the phases of Restore Illinois reopening plans, working to educate and assist them as they strive to operate safely during COVID-19 and in compliance with both state and county guidelines. So Rebecca, I am going to toss it over to you.
Thank you. Thank you, Kaylin. And I'm working through the system here to see if you can, I'm going to go ahead with the presentation and we'll talk through the PowerPoint and attempt to get back so that you can see me while I'm talking. I know that was something that they told us we could do, and I'm being challenged by that at the moment.
Oh no, if you want to go back to In Touch and then turn on your, yep, perfect, and then turn on your camera again, it'll,
the camera.
Yep, it'll start automatically. There you go.
There you go. All right, are we back?
Oh, perfect.
Yep, perfect.
You look great.
That worked? Okay. All right. I really appreciate having Mike go first because he does have that this is the guidance, these are the rules that we're all working under. And I'm presenting this really from an employer's perspective. So this is what I have worked through with our clients and with some other not-for-profits that I work with over the last few months. So this is going to be a very practical approach, sort of a high level of what you need to be aware of as an employer as we work through this stage of COVID. So there are three things that I look at when I talk with a client about reopening business or about having someone test positive in their business. And the first one is your general obligation to have a safe workplace. The second one is, are you now in a position where you need to be providing paid sick leave under the Families First Coronavirus Response Act, which was passed way back in April? And then how do we manage the other employees' expectations and fears, their relationships with each other, and confronting the public that come in and out of our offices? So we don't often think about OSHA, those of us that work in offices or retail establishments. A lot of times we think of OSHA as being something that applies to factories and applies to places that have chemicals going on. But OSHA applies to all of our workplaces, and it's really the overarching obligation that we're looking at and that the CDC has behind their guidelines. So the idea is that your workplace needs to be free from recognized hazards that are causing or are likely to cause death or serious physical harm. So over the course of the last 7 months, the awareness and the knowledge that we have of the harm of COVID-19 has changed. So we now know that COVID-19 is a hazard that could cause this kind of serious physical harm. That doesn't mean that we have to close. That means that an employer then has to take action to mitigate known risks. So some of those are things that we're seeing already. Most important, they kind of go in descending order of what an employer or a business should be doing. The first one is what we call engineered safety measures. If people can work from home, let them work from home. If you can put up space barriers, those plastic shields or taller office cubicles, do things like that so that people are, I'm going to go back to what Mike said, 6 feet apart. Distancing is one of the most important things we can do. The next thing that we look at are administrative controls. So there's a new word that's being bandied about, and that's de-densify. So we want to de-densify our workplaces, our business floors. So that's the concept of having maybe only 25% into a retail establishment or only 50% into a restaurant. So do what you can to, again, move people away from each other, and that includes your staff that are serving them. The next thing is those workplace practices, and these are the distancing. So whether we're meeting together just to talk over an issue or how often we clean, and those things need to become habitual, that these are the cleaning practices that we do. So when you see that people are, they are using better hygiene practices, they're cleaning down commonly touched surfaces frequently. Those are all those workplace practices. Those duties should be assigned to people, and we should all be very aware of them as we work. And that's, when you go to sign a receipt and they give you a fresh pen, or somebody's got the bottle of hand sanitizer right there at the counter. And then this isn't the last thing, but it really is probably one of the least important things that the employer does, because it varies depending on the workplace. And that is that we, as people that are not working on the front lines, if you will, that we are wearing face coverings, plastic shields, other things. Do those first 3 measures first, and then wear your face coverings. As Mike said, your face covering does not make it a non-exposure if you are within 6 feet of someone. I'm not saying don't wear face coverings, but don't rely on your face coverings of your employees. When you do have an employee that either reports symptoms or reports an exposure, you are also obligated as an employer to provide this new federal right to paid sick leave. This also came out of the Families First Coronavirus Recovery Act. And initially, we thought we were going to see a lot more of this. And I think that in April and May, I had several calls from clients about this issue. I think when we look at it now and we look at what we've learned, I am seeing it less and less. And here's why. The paid sick leave is available if someone is subject to a quarantine order. And a quarantine order is the kind of order that the city of Chicago has. So the city of Chicago, I think right now, has 20-some states on an order that you must quarantine when you come back from visiting one of those places. That is a government order. The second one is that you were actually advised by a healthcare provider to quarantine. In most instances here in the workplace, we don't ask a lot about employees' health conditions. We're very sensitive about ADA protections and privacy rights, but this is a time when it is appropriate to ask the employee, did your healthcare provider tell you to quarantine? Is there a reason that you need to? And the third reason is if someone is actually experiencing symptoms and seeking a diagnosis. So as sobering as the statistics were that Mike showed us, very often we have employees that are exposed to or have had it, as he called it, contact with someone, but they are not themselves experiencing symptoms. So from this particular angle, the paid sick leave, they are not necessarily entitled to that paid sick leave, even though we might be asking them to quarantine for other reasons. We also thought that we were going to see a lot more of the paid FMLA leave, and that is when a family member or a roommate, someone who shares a dwelling, is caring for an individual that is covered by one of those first criteria, or the caring for children with closed schools and daycares. I will say we saw quite a bit of that in late April and into May as people were figuring out what to do. That is a 12-week right to that particular benefit. I'm not seeing as much of it right now. Maybe my clients have all figured it out, but we're not seeing quite as many queries about that. The poster on the right-hand side is a poster that should be hanging in your workplace, either in the break room or back in the coffee area, so that people know what their rights are. And if they have a question, they can look into it before they bring it to the management. These next 2 slides just have additional details about how much leave you get. It's roughly, it's 2 weeks, which is roughly 8 hours. And if you're a part-time person, we prorate that. If you're getting the paid sick leave because you're caring for someone else, you're only getting 2/3 of your regular pay. For employers out there, if you do have to give this leave, if you do have someone that qualifies, there are going to be tax credits for that for 2020. And this particular leave, as of right now, will expire on 12/31/2020, unless it is extended. So the issues that are popping up over the summer are these return to work issues that Kaylin mentioned. And they are, what do I do when someone tests positive? And so I call this travel, time off, and testing. And travel has been a big issue. There's been a lot of confusion about travel. As I mentioned earlier, the city of Chicago does have a quarantine order, and they do have rules about people coming and going. We do not have those same rules in DuPage or Will County or or even in the state of Illinois. So there's no requirement. However, this is where every one of you as an employer, as a business owner, is different. And you need to have a conversation with either your attorney or your HR representatives, or maybe with Mike and DuPage County Health Department as to what do I do? What makes sense in my workplace, given the distancing that I have in my workplace, what I can engineer for safety, the frequency of outsiders coming in and out. So what I might say to a dentist is different than I would say to someone that runs a childcare facility, and it's very different than someone who has an insurance agency. So it will depend on the employer. But this is another difference from what we would normally talk about. As a general rule, an employer does not ask an employee what they do on their off-duty time. However, during this time, because of the risk, because we want that safe, hazard-free environment in our workplaces, you can ask someone about their travel out of state. So a quick example, I had a client who had 2 employees, and they both went to Wisconsin back at 4th of July. One of them went to their lake house in northern Wisconsin. The other went to Lake Geneva. So we had 2 different scenarios that we had to talk about with exposure. They were both in a state that at the time we had some concerns about, but they engaged in different activities. So my next bullet is you need to set out and apply consistent rules about off-duty travel, but they also need to be situation specific. You can require an employee to stay home, and this is a quarantine. If someone comes in and you learn that they were one of the people that went to Lake Geneva for the 4th of July weekend, or maybe the Labor Day weekend, and it was just an ongoing party with close contact, no distancing, no other precautions, you may ask that person to quarantine. One of the things, and I didn't hear Mike say this, but I'm hearing it in other jurisdictions in Illinois, one of the things that we're seeing is if someone is in quarantine for that reason, and so it's a suspected exposure, if you will, and they are symptom-free for 5 days, and then they're tested and they're negative, there are employers that are finding that that's a comfort level to bring that person in. And I'll be interested to hear what Mike thinks about that. But as an employer, you're dealing with a little bit of a different standard, and you're managing your workplace, again, starting with those other criteria first. The other thing that you can do as an employer here is you can require the employee to tell you about their COVID test results. Generally, we would never ask an employee about their results, but here you can, and you can also ask them about their symptoms. Do they feel symptomatic? Some employers are doing this on a daily basis. When an employee comes in, they do a checklist. Some employers are taking temperatures every day. I'm not saying that you have to do that, but if you feel that given your workplace and your employees, you want to do that, I think you can talk with your HR consultant or your attorney and figure out how best to do it. And then to the question of, then what do I do when I know that someone is tested positive? You do have, as an employer, you have an obligation to tell the people that might have been in that close contact. So if that person, works with other people within 6 feet and that exposure is longer than 15 minutes, then they need to know it. Ideally, that needs to be anonymously. I will tell you, I think it's difficult to make it anonymous because people know who they work with regularly and they know who didn't come into work on Tuesday. So I think to the extent that you can, you want to use as much discretion as possible, but you have that obligation, that general duty to provide the workplace that's free from known hazards. And I think that kind of trumps everything at this point in the learning. So that's my general overview. Again, I welcome your questions and look forward to the rest of the conversation. Thanks.
Awesome. Thank you, Rebecca. My question list is getting long. I'm very excited for all of this. Not that you didn't cover, it's just like I have so many questions going through all of the different scenarios. So I'm really excited to see how this conversation gets started. And a reminder, everybody, there is a little chat feature on the bottom left corner that you can type in your questions as well. And our last presentation is from Kevin Courtois. Kevin is the Executive Director of Congressional and Public Affairs at the U.S. Chamber's Great Lakes Regional Office. To achieve the U.S. Chamber's public policy goals, Kevin cultivates and maintains legislative, political, media, and grassroots resources throughout Illinois, Indiana, Kentucky, Michigan, Ohio, and Pennsylvania. Kevin leads the U.S. Chamber's efforts to strengthen its relationships with members of Congress through member businesses, associations, and local and state chambers of commerce like ours all across the region. Thank you, Kevin, for joining us, and we look forward to hearing from you.
Well, thank you, Kaylin, and thank you to you and Reba and the entire team. It's a great pleasure to be with you. I cannot wait until we're all together again in person, and I'm able to around the region. You mentioned all the states that I cover, but I have been here in my apartment in Chicago for 6 months, and I'm ready to get up.
Oh, hey, Kevin,
Really
sorry, one second. Rebecca, I think you might still be sharing your screen.
Oh, I'm sorry.
No problem.
So,
Okay. Kevin, I think you're good.
All right, let's see if I start speaking. Hopefully,
I've been watching Kevin for a while.
Yes, you're good.
Well, thanks. And Rebecca, awesome overview. It's really interesting. At the U.S. Chamber, we work on the federal policies and to see, how after that legislation passes, and you talked about paid sick leave, paid FMLA, how all of that is implemented, and then, of course, working with businesses across the region, hearing back on what they're dealing with, and really trying to thread the needle on getting the economy back up and going, but also keeping, employee, customers, and themselves all safe. Also, I want to kind of put this into context. So I'm talking about liability protection, something we're looking to achieve at the federal level for businesses. But if we look at kind of the pathway there, so we had the paid sick leave, FMLA was part of what we refer to as the phase 2 bill. So Congress acted in response to the pandemic, and they passed phase 3, which is the CARES Act, which I'm guessing most, if not all of you have heard of. That's what included programs like Check Protection Program, meant to be a bridge to get us to the other side of the. After that passed, and as we were looking at implementation, almost immediately started looking at, well, what's next? What else do we need to do to reopen the economy and get us, all back? So as we figure this out, as we go along, and of course we get new information every day, this has evolved. The conversation has evolved. But what we knew was that as businesses reopen, and as we, see the continued threat from the pandemic, businesses trying to adapt, attending webinars like this to figure out best practice, how do I remain compliant? We knew that liability protection would be an important component there. So I'll first cover some of what we're looking to do at the federal level. But what we're trying to do is get this included in what we're calling a phase 4 bill. U.S. Chamber kind of issued 5 of our priorities, and the number 1 was liability reform. What we're going to do is have liability reform that is timely, targeted, and temporary as it relates to COVID-19. So 3 pieces that were part of our recommendation had to do with PPE, so makers and distributors of PPE. So not just like N95 masks, it's also meant to cover, we have distillers who are now making hand sanitizer, other manufacturers who are making, face masks or ventilators. So it's meant to cover businesses who stepped up to provide or to donate the PPE. And we know a lot of businesses have kind of played that role as we all kind of collectively fight this pandemic. Second piece is related to liability for healthcare providers. So this is the medical liability that would protect frontline workers, medical facilities, nurses, doctors, and other healthcare entities so that they're not subject to unwarranted litigation as it relates to their care for patients with COVID. And then the third piece is perhaps the most important, and it's for the business community, and it's what we refer to as the exposure liability. So this would be for a customer, an employee, or a vendor would claim that they contracted COVID-19 at your place of business, event you're hosting, and that you should have, as an employer, taken more precaution than you did. So what we're looking for is a safe harbor here. Again, temporary, targeted, and timely. The safe harbor would operate on the basis that, yes, so the entity is following applicable federal, state, and local public health guidance. They're doing this in faith. And what it would do is provide a safe harbor against litigation. So an important piece here, does not protect those that would that engage in willful misconduct or gross negligence. So this isn't something where there would be blanket immunity. But if you're doing the right thing, generally, if you're doing all those steps that Rebecca covered, that Michael covered, that you won't then subject to really frivolous litigation. So importantly here, this isn't just about the business community. What we're seeing also is with nonprofits like chambers of commerce, but also education community. So we partner with about 77 university and college associations representing the vast majority of higher education and communicating these priorities, because we'll see as schools begin to reopen. And I was on a call earlier today where I heard a member of Congress talking about the district that are going to a hybrid model or going completely virtual because of the fear of litigation. So they have the steps in process to keep children and teachers safe, but it really is a fear of litigation that's keeping them from opening. So we have kind of several partners, business community and education, working on this. And that is for one priority as it relates to what we're talking about today and phase 4 litigation. But to bring it back a little bit more big picture, I want to talk about just generally what we're also looking to accomplish in this next round of legislation. So we see the economy, we had no idea where we would end up or where, how recovery we would be back in March. And perhaps, we hope that we'd be past this by now. The CARES Act passed, but we see we're looking at kind of a K-shaped recovery. So part of the economy, we talk about the tech, retail and software, we see them recovering, maybe the traditional or what we call V-shaped recovery. So saw the dip and saw them quickly recover. But that there are industries that are going to be the last to fully recover, like travel, entertainment, hospitality, and food services. It's going to be some time before we see a full recovery there. And there's going to need, and we need is additional federal assistance to help those industries make it through the pandemic until we get back to normal. That's one of the things we're looking to do, is provide that bridge. So we want to support those small and mid-sized employers. And also, we know that the economy might look different. So our most recent surveys found that, unsurprisingly, 20% of employers had less employees than they did in February. But perhaps surprisingly, or what I found interesting, was 11% of employers had more employees than they did in February. So we see an economy that the need for talent is shifting. And so part of this recovery package and what we included in our recommendations was training, employment training, and job training to make sure we're getting people to the places where we need them. Other piece is there are conditions precedent to a successful opening of our economy. And we're starting to see this already with schools reopening and child for those working parents out there. And what we asked for was funding and assistance for schools and childcare as they look to comply with the recommended guidance, keeping everyone safe. Of course, that means additional costs to those entities, and so federal assistance in that. And then the other piece is what I talked about, some of these threats to a successful reopening, and that would be from the outside with unwarranted lawsuits, and that's where we have our 3 liability protections recommendations. In terms of where we stand, they have seen that the Senate introduced what they're calling a skinny bill this week. They're set to vote on it this week. It's the smallest of the 3 packages that we've seen. The first was out of the House, so the Democrats introduced a $3 trillion phase 4 bill. And then the Senate, before the August recess, introduced a $1 trillion phase 4 bill called the HEALS Act. And then the Senate today, quite frankly, because there wasn't complete agreement among Senate Republicans on what they would pass, introduced a skinny version of this bill, which is a cost of about $300 billion. So negotiations are ongoing. I was on a call earlier today with a senior member of the House who wasn't quite hopeful about getting something done before the end of the month. Certainly going to keep continuing to push our message, which is that there is a cost to inaction, and that those priorities that I outlined are needed to get the economy back up and running and to get us through the pandemic. Of course, we have an election. Have to pay attention to outside factors here. We have an election where it may be after the election that some type of phase 4 stimulus package is through. But this continues to be a day-to-day operation. I think what we can do as a business community is to outline our priorities and then encourage members of Congress, as we do in so many other issues, to work together to find common ground to get these problem-solving solutions that we're asking for. So we have the phase 4 legislation, House has the HEROES, which did not have those liability protections, the Senate's HEALS Act, and also the Senate's skinny bill introduced this week does include the liability protections. But before we get to those protections as outlined, as I just outlined, there are a number of other issues they need to resolve, such as the additional unemployment insurance that was included in CARES, some of the assistance to small businesses. A big outstanding item is also state and local funding, which we do in our recommendations as well. We've seen a drop in receipts, across the country for state and local governments. Certainly, the issues that Illinois has, with our budget issues here, and so there's going to be between $1 trillion that was proposed in the House's HEROES Act and the version which did not include any assistance for state and local governments. There's a lot of space between 0 and 1 trillion that we hope they can land and find some assistance for those state and local governments. So I'll end there and look forward to the Q&A. Thank you.
Awesome. Thank you, Kevin. So I see have already typed in questions in the chat, and I'm going to try my best to direct them to the right person, but you all may have to bear with me here a bit. Mike, one of our first questions is the 15 minutes. We keep hearing, within 6 feet for 15 minutes. Is that a continuous 15 minutes, or is that, 5 minutes 3 times or throughout the day? What is that?
Daily exposure.
Okay. Oh, okay. So if I am interacting with you within 6 feet for more than 15 minutes in the entire day,
Correct.
masked or unmasked, or
Correct. Yep, masked or unmasked.
Okay. Rebecca, if an employee opted to do personal travel to one of the states that Illinois has a quarantine, do we have to pay them for those 14 days? I think, is it just Chicago that has the quarantine? Rebecca, I'll let you take that one.
So if they elected to take personal travel and they don't have any symptoms and they don't know that they were actually exposed, so that 15 minutes within 6 feet, then it would be up to the employer to decide if they want that person to stay home. The paid sick leave trigger is that a healthcare provider has ordered them to quarantine, or that they are experiencing symptoms. In my experience, most employees who go to talk to a doctor, they call their doctor will say, oh, you better just stay home. So they will get that quarantine order, if you will. In that situation, yes, if they're staying home and waiting because they made that decision, the employer might be under the obligation to pay the leave. The thing to remember about the leave is they're only entitled to 10 days. So if this is someone who wants to use their leave when they're not really sick, that's up to them. And I have had employers that say, I'm just going to go ahead and pay it because I don't want them back in the workplace.
And then, does Illinois have a quarantine order? I thought that only the city of Chicago had a quarantine order, not the state of Illinois, but I could be wrong.
I'll defer to Mike, but as far as I know, only the city of Chicago.
Correct, only the city of Chicago. I just looked at Illinois' website and they've not changed it, so no, there is no requirement. However, it is funny that when they talk about certain states that they would recommend you quarantine when you go to, Illinois has the same color as those do as far as the states you should be in. So that's funny.
All right, Mike, this I believe is for you as well. There's significant noise about the COVID death rate. What is the death rate in Naperville from COVID only without any other underlying underlying medical issues or comorbidities?
The numbers we have do not have the non-underlying versus the underlying. In Naperville, DuPage County, there's 38 deaths.
Okay, and of those, you know what percentage of those is in the 65 and older or from long-term care facilities?
I do not have that information available.
I think this is Rebecca. Let's try. If an employee has family members who've tested positive and they went to get positive and they're waiting for the results to come back, do we have to pay for those days off? So my husband tests positive. I've got 2 questions with this. My husband tests positive. Well, I'm waiting for my test. Do you have to pay me? And then if I come back negative, but we live together, can I still come back to work, or what are the guidelines around that?
So again, employers are going to deal with this differently depending on the format of their workplace. So they're going to look at their own workplace and can I isolate Kaylin if she needs to come back? In most situations, employers are going to say, if your spouse or one of your children that lives in your home tested positive, they're going to want you to, again, at least wait those 5 days, take a test, see what happens. There's very little value in a person going to get a test the day after they think they were exposed. It takes a while for the virus to manifest, to be testable, detectable in someone's system. So I am seeing employers, though, that will say, I will pay you to stay home until we find out whether you are positive or symptomatic, one or the other. And I'd like to hear Mike's response on that one, too.
Depending on what it is, we prefer with the 14 days following. If their husband was or wife was positive, we would follow the 14 days quarantining from the test or from when they had symptoms is how we would do it. Now, there is 2 options to the 14 days of not having to follow it. That's for healthcare workers or essential workers. That would be first responders. There is some differences to that. But everything else is actually still, we go with the 14 days. The testing for close contacts is really only for ill or people that are having symptoms. For close contacts, we're not looking for a testing protocol on that.
Okay. So stay with me on this hypothetical for a moment. So my husband has COVID. I test, either I'm waiting for my test or I test negative. I guess they're 2 different scenarios. And I've been here with my employees. Do I have to close the office at all?
From the health department, because you're still 1 section away from it, you don't, unless you had some illness or you were positive, and that would only be the employees that were within 6 feet of you then have to go back to it. So I look at it, I play, if I'm a little bit older, so I use the Kevin Bacon game. We're 5 degrees away from Kevin Bacon, so it's the same thing. You have to be within 6 feet for 15 minutes of an ill person, a certified ill person. So anybody else, somebody down the line was exposed, but if they don't show symptoms, they don't have anything, and they're quarantining at home, it doesn't mean that you have to quarantine it, is the basis on that.
Okay. And Rebecca, you may be able to help me on this. Let's say my poor husband, he doesn't have it, I swear. Let's say my husband has COVID and I decide to stay home or choose to because my employer lets me. Can I continue to work from home, or do I have to take the paid sick leave, or is that up to choice?
It's going to be up to the choice between really you and your employer. Ideally, again, we go back to that hierarchy of what do we do to mitigate risk. The first thing we do is, if you can work from home in a quarantine environment, that's the very best thing for the employer. In that scenario, if you are unable to work from home and you're living with someone who is positive, most employers that I'm seeing are going to pay you to stay home because they're going to tell you to seek a healthcare provider's guidance on that. And that triggers the paid sick leave. And most of them are doing it as a way of encouraging you to not come back into the workplace and possibly expose others. Although most of them, if you go 5 days asymptomatic, they're pretty comfortable with the negative test. Because there are some people that can be exposed and for whatever reason are not testing positive.
How would you reassure an employee who was 6 feet away, so keeping the proper distance from a positive case for less than 5 minutes, that it's okay to come back to the office? So if Susie tests positive and we're not next to each other, but we've both been in the same office, how do we reassure me that it's okay to come back to the office?
If that's going to me, what I would start with is go over your protocols for cleaning and sanitizing all the common surfaces. Let them understand, here's what we've been doing, here's how we've been doing it, and here's what we've already removed anybody who was a close contact. Therefore, we've taken them all out of the place. So now we're down to non-close contacts. And I think the other thing you need to reassure people is, has that person or Susie, has she gone to the store? Has she been out in public? Because once you go below 15 minutes for 6 feet, it's the same contact you'd have at a grocery store or at a retail store or at a restaurant. So I think, are you staying home? If they're staying home from there, you may have to have those discussions. If they're a stay-at-home person, they're only going to work, that might be a little bit more difficult, but mostly everybody else is trying to leave a little bit of more normalcy and going out. And that's the same risk you would have of just going to the grocery store.
All right. And then Mike, can you talk about, do we know at this point how long it lives on surfaces? Are we still, anytime someone interacts with something, we're still using the Clorox wipes. What is the proper protocol for the cleaning of our offices?
So that's in the DECIO guidelines, and it depends on if you're an open retail space or if you're just an office space, it lists in there how often you've got to go ahead and do it. The most common ways is every 30 minutes to doors or stuff where people are coming in, bathroom stalls and stuff like that. Office buildings, a little less. I think it's 3 hours. You'd have to look for sure to read all of it, but it lists all in there how often you need to do all the high touch surfaces, depending on what type of business you are.
Okay. Rebecca, did you say that the leave is a one-time use? What happens if an employee continues to engage in high-risk behaviors? You're going down to whatever the hotspot states are every weekend or whatnot. How do you deal with those scenarios where people would have to keep using leave, but they run out of it?
That's a really difficult one, and those are those difficult conversations to have with the employee. The employer's obligated to give those 80 hours of paid leave for the reasons that we talked about. If someone repeatedly is engaging in that, and the employer believes that they are presenting a hazard in the workplace, I'm recommending they be put on leave without pay. We've had a couple of employees that we went back and furloughed. And so it was a furlough, not because the employer didn't need them, but because that employee just really could not play by the rules. And it was putting too much risk in the workplace for the business owner. Who knows if that employee will still be around when we're through all of this, but they're only obligated to pay for the 80 hours.
Okay, I've seen some restaurants in the area have a server test positive and decide to close for 14 days. I don't believe that's in the recommendations, but Mike and Rebecca, can you talk to me, if a server does test positive, do you have to close for 14 days? Do you have to close at all, or is it just in the cleaning and removing the person who was directly in contact less than 6 feet, more than 15 minutes?
So yes, the closing for 14 days is not required. It is some policies of some corporations, so you will see that, and that's their risk management has decided to take that approach. As far as the health department goes, correct. We have to make sure, find out any employees that were within 6 feet, quarantining them, cleaning all the surfaces. And the other biggest thing is the recommendation, which we ask everybody to do, is following the CDC's, because the aerosolization of the disease can last for 24 hours, to make sure that person's been out of the building for 24 hours. So we know it's all landed, they've cleaned everything, sanitized everything, and then we know there's no more risk to anybody else going into the building.
And then I've also heard people saying they need 2 negative tests to be allowed to return to work from their employer. Is that their employer's choice, but that's not, health department or legal guidelines?
That is not health department guidelines. A lot of guidelines that comes from is the medical professional that corporation is using, which you're allowed to use as something. My concern with that is I've seen a lot of people hold on to positive results a long time, and they show positives for months, and they've had no symptoms, they have no issues. and that becomes an issue instead of using your normal amount of time where the virus is no longer transmittable.
So how do I know it's no longer transmittable? Let's say I've been testing positive for 6 weeks. Do I have to stay quarantined, or am I going off of the days since I last showed symptoms?
That's why we use days and not testing, especially for people that are not ill. And if you're ill, basically making sure you're over your illness, you have no more symptoms, and then you're 24 hours past that is after the 10 days you're allowed to go in. So we use, as a health provider, our medical people always tell us we're using time as our control. We're not going to testing. However, you can use testing.
Sure. We don't have sick leave for a small business, and we only have vacation and PTO to use for sick days at the employer's discretion. With that said, we had an employee who thought she was exposed and the test came back negative, but decided to work from home while she waited for the test results. Are we liable to pay for those out of office days?
So 2 parts to the answer. The first part is the Families First Coronavirus Response Act paid leave applies to all employers with less than 500 employees. So there are some, as you probably know, there are some employer obligations that do depend on how many employees you have. That paid sick leave is available even if you only have 2 employees. So you would have to pay it. The question there would be, is she staying home because you as the employer told her, go get tested, go talk to a doctor, or is she staying home because she doesn't feel like she should be there? So we go back to the trigger really is that a healthcare provider has said, you need to quarantine because you were exposed, or you actually have symptoms. And again, more often than not, people are not expressing symptoms, but they're concerned because of the level of exposure they had. And that, I think, really gets into that conversation that you want to have with the employee. Did you bump into one friend at the grocery store and talk for 5 minutes? Or were you around people at a party for 6 hours where there were multiple people that have since come down with COVID? So what's the level of the exposure?
Sure. How do you handle positive cases in a multi-tenant building? So as a landlord, do I have to let all the tenants know in the building because I don't know who's interacted with other tenants, for that 6 feet, 15 minutes? Are you just letting them know in that affected office? Are we liable to do the extra cleaning and all of that to mitigate the landlord's liabilities? Rebecca, I think I'm going to try to start with you on that one. Do you know?
I'll start with it, and this actually might be a good one for Kevin to jump in on because it talks about liability. My recommendation would be, if that were my client in a multi-tenant building, I would advise the other tenants that someone that frequents the building, that might have used the elevator buttons, touched the staircase rails, has tested positive, and they should be aware. Also, as a landlord, depending on the arrangement, I do think that adding extra cleaning protocols is appropriate. I have actually seen some surcharges, if you will, for extra cleaning during COVID that are coming in as part of the common area maintenance fees. So I don't think that's unrealistic. I'm not necessarily sure about liability for the various reasons that both Mike and Kevin had mentioned, and that is most of us are also at grocery stores, pumping gas, walking in and out of other establishments. So establishing liability would be difficult, but I'd like to hear their thoughts.
Kevin.
Yeah, so interesting question on the, tenant kind of whether it's commercial or residential. I haven't seen, this would be like a duty to notify, right? And I haven't seen anything specific on, so this is where really the tenants can be operating the place of business, allowing others to, operate business, and again, anything specific on it. However, in terms of like the duty to notify, it may be captured in the sense that if there is a best practice, if there's a CDC guidance on this, that if you're following it, then you may be included in this I just haven't seen anything on it specifically.
Interesting. And then, Kevin, I know you mentioned the election earlier. With the election in 50 some days, I believe, and either way the results go, do you see that affecting any of these protocols, or mostly do you think that will affect legislation? What do you think the outcome, or what do you think the election will have effect on the businesses and how we're handling COVID, or trying to get relief as well?
Sure, that's a really good question, and very relevant, because we're looking at election coming up, and then Congress is about to go back into session. But I think there's just 11 days of scheduled, session days, quote unquote. They'll be back in DC working until the end of this month, and then they get home, and it's full blown campaign season. Already kind of there. Before they leave, what they need to do is pass legislation to fund the government. So we're looking at other potential government shutdowns should they not act on government funding by the end of the month, or just the end of the fiscal year. Of course, that would be another huge obstacle. We're in the middle of a pandemic, so they're going to have to figure that out. The way that the election kind of affects this is, what will they actually agree on new numbers and priorities? I think what's more realistic is what they call a continuing resolution, or a CR, that will just fund the government at current levels, and then you have to ask for how long. So I've heard some say that they'll look to fund it into maybe mid-December, so that look at the election results, and let's say if Joe Biden wins and the Senate takes over, so that there's still some leverage for the current administration and Senate against Senate to negotiate a deal in December. Today I heard that maybe they'll do a continuing resolution into next March. That might be agreement there, because it'll be, perhaps Democrats, if let's say if there is a full sweep, that then they can, Joe Biden can get his footing in the White House, and then they can figure out this budget. So a lot of it is done there. It also affects the phase 4 legislation in this case. So right now, a cynical person might say this phase 4 stimulus will not get done because Democrats don't want to hand the president a win right before the election, and also they don't. We all don't know what the incoming government in both, executive branch and the House, and especially the Senate, what that will look like. And so everyone's waiting until after the election, where we kind of have what we have right now, and address what the COVID needs, what the economic needs, what the human needs are after the election, once that shakes out. So we're not going to disrupt anything and give anyone a win, and we'll kind of know where we stand. Problem with that thinking is then we have an additional 3 months before we get all of the these needs, and we know that businesses need assistance now. The businesses need to know have that certainty in terms of those liability protections now. So I won't say I'm hopeful something might get done, but I also have to be realistic in that we have those realities in terms of the political environment that we're in. And my experience, it is very difficult to get anything, a major piece of legislation done right before an election. But like we said, we're in unprecedented times, so we'll keep pushing.
What other questions do we have? I know other people have questions other than me and Mari, although I will just keep going with my hypothetical. Otherwise, I'm trying to think of other scenarios where I've come into. I know we're talking about the 6 feet and 15 minutes. So Mike, you know this answer. If I have a large conference room, I'm able to be 6, 8, 10 feet away. Do I still have to be masked? I know it, or not.
Our recommendation is to be masked. When you go back into the DECIO requirements say if this is your normal team that you're always with and you are 6 feet apart in a meeting, that you don't have to wear a mask. But the health department's recommendations are that you always wear a mask.
Okay. And I know Rebecca mentioned face shields, but we are not looking at face shields or vented masks that have the same effectiveness as much as the regular mask. Is that correct?
That is correct. And that's mostly due to coughing and aerosolizing of the virus comes out, is the cloth or any sort of mask should catch that. I know there's some, if you actually even read an N95 mask, says this does not stop a virus. Yes, the virus itself is so small, it'll go through any mask. However, it can be attached to some liquid coming onto the body as you're spraying out. That's why any of the mask will actually catch it. And the problem with the actual shields is when you're breathing out, it can go out the two sides of the shields. Some people like it as a second thing of protection, and that's fine. Especially for eye protection now, it's a great idea. If you have fogging up with your glasses and stuff, some people like the shield, especially in a manufacturing situation, and that works fine too.
Any other questions? Like I said, there's a chat there. I think you can raise your hand or chat as well. Here's another one. If we're hosting a company picnic with under 50 people outside, do they have to wear masks at all times? And do we do temperature checks?
Well, the masking outside is also a challenge. If we're going to keep everybody away, I just don't know how we could all stay away from each other as you're trying to actually have a company picnic and discuss with everybody. Out in a park where we're seeing people we don't know, I think you can stay far enough away. But I think in that case, you couldn't be. As far as temperature checks, you can do temperature checks. From what we've actually seen is where we've had employees go into a building at 8 o'clock and they check them at 8 and noon. And by 10, they have a fever when they didn't have one at 8. So it's more of a self-reporting thing and more of just everybody reporting themselves. And if they don't feel good to stay home, seems to be the better way of working from there.
Okay. What about the use of plexiglass? When is it required that we have to have plexiglass, and what are the requirements around that?
There are no requirements for plexiglass. That is part of what Rebecca was talking about as far as the engineering things. There's sometimes where you cannot keep the customer with 6 feet away from your employees, and that's why you'll see it at your gas stations and everywhere else, because it's almost impossible to do that. So that's where they've installed that. There is no requirement to it. It doesn't say how high, how far, how much to put in. So it's more of talking to your risk management people or making a decision of what makes the most sense for you and your business.
So more of a risk mitigation factor. And I know Rebecca was talking a lot about those as well. Well, I'm going to send it over to each of you for just a final closing statement here after our last question, just to kind of wrap it up. Anything else that you've kind of heard of or thought of? And this has been incredibly educational and informational, so thank you all. Our last question is, how do we handle the paid time off due to no childcare? How many days can they take? Is it the same 10 sick days, or is that the time? Rebecca, isn't that up to 12 weeks of the no child care? How does that work?
Correct. If someone's school or daycare is not available, they can have up to 12 weeks, but it's at 2/3 of their compensation. It's not at their regular pay. And that can be intermittent. So if there's another spouse or caregiver in the home that can watch the child during certain periods, then they can work that out, but they could receive that paid sick leave, that paid FMLA over that period of, I guess that's 50 days, make that 60 days, right? If we're doing it intermittent.
Yeah, I think that's
And Rebecca, that's not in addition to the paid sick leave, right? That would be kind of included in that.
Correct. In most situations, that employee is going to exhaust the paid sick leave in the first 2 weeks, and then it's an additional 10 weeks of FMLA. The way that Congress structured that was a little confusing at first with the different criteria, but that's how it is played out, is you take off the first 2 weeks to stay for the child, to take care of the child, and then the next 8 weeks for the FMLA. The next 10 are FMLA.
Is that for the company of all sizes under 500?
Yes.
And then if your company is all virtual, I know you noted to put it up on your bulletin board. Is that something we can just email out to our employees as well if we're not in person as much?
Absolutely. Email it out to them, or if you have a page that the employee handbook sits on and expense request forms sit on some sort of a platform that people come and go to. Very often a payroll system has sort of that notice function. Just put it in there so that they have access to it.
All right. Well, wonderful. I'm going to let Kevin speak first. Kevin, any other wrap-up comments or anything else that you want to let the group know about your employee or employees having COVID and kind of what we do to make sure everything's protected, legal, and safe?
Sure. I would say this. U.S. Chamber has been really, I guess, at the on the front lines of a lot of the federal action on this. And then this is just a shameless plug, but I would recommend you visit, our website at uschamber.com/coronavirus, because we've been producing, especially for the small businesses here, we've been producing a number of different guides that will help you walk through the various federal programs that we have. And then our foundation has been working on these, best practices, looking at to just how do you market your business in these times. We have a dedicated small business website called CO, so it's CO, where it's going to offer a lot of these, the best practices, and then thinking ahead to just business operations and things that you may be confronting. The idea being, that you shouldn't have to do all of this alone, and certainly it's a role that all of our chambers of commerce play. So, as a partner in figuring this all out. So, thanks again to the Naperville Chamber. I mean, you guys are just fantastic, always setting the standard, and have a local partner who's not too far. I look forward to seeing you guys soon.
Wonderful. Thank you, Kevin. Rebecca.
Sure. Thank you. Thanks. I want to close with two things. And one thing I should have mentioned earlier in the question bore this out. As the employer, when people are requesting this federal medical leave, you need to be keeping track of that. So I don't recommend that it necessarily go in an employee's personnel file. I recommend you create a different file that is specific to this particular federal mandated sick leave. And you keep track of it so that you have, first of all, accountability. Should there ever be a question if you have treated someone unfairly, treated employees differently, and if you need it for accounting purposes, for taxes or other. I also have a form that one of my clients developed as a way to have the employee actually make a physical request that this is their circumstances and this is why they need this leave. I think as an employer, sometimes it's important to have the employee take ownership of that. And we use similar forms when employees request family medical leave in normal circumstances. So it's nothing overly burdensome, but here's my situation. I request the leave. I request to be paid for this time off. My general comment would be, this has been informative for me, so thank you for letting me participate. But also that I hope what you've heard is that these are very situation-specific decisions, and the protocols and the things that you do depend on your business, and you need to always take that balanced approach. So you need to look at the circumstances and the people, and that includes that question about the person that was fearful. So as an employer, you're working with them to give them what comfort you can. But take a balanced approach and talk to your own HR specialists and attorneys. Thank you, and thank you, Naperville Chamber.
Wonderful. Thank you. And Mike.
Well, thanks, everyone. I appreciate the time to talk to everyone. And my biggest thing is, again, 6 feet, 15 minutes will make all of this be much easier on you and your employees. And what you have to do, you only have to ask the person that's ill to leave. Everybody else can stay. It does make it go a lot easier when instead of having to walk around and ask everybody, then ask your managers, and then all the other stuff like that. So if you can do that and visit our website if you have any questions, the website has a lot of good information in there. And like I said, if you need anything, our email address is right in there for the business team. Just send us at any point. We check it on weekends. We try to respond as much as we can, as often as we can on weekends, but at nights and stuff, we're working and we're answering those questions. So if you need any help, just let us know. Thanks again.
Awesome. Thank you, Mike. Thank you, Rebecca. Thank you, Kevin, for your time and expertise and really just sharing with us. This was absolutely incredible. Huge thank you also to Idea Nova for sponsoring this presentation, which is going to be, or it was recorded, so that you can watch this again and just re-listen to some of this fantastic information. So thank you all for joining us. Check out naperville.net. We have a lot of fantastic programs coming up for you over the next few weeks. Socially distanced, masked, in-person distance and mask, and we will make sure to keep that 6 feet and 15 minutes good. So thank you all of you for joining us. Stay healthy.